So before you go out and you buy a Medicare Advantage plan, or Disadvantage as some may call it, take a listen to this interview I had with my wife. She's been a professional in the medical field for over 11 years, and she knows a lot about this, and I thought it'd be great for you to hear some information and some interesting facts about it. So I'm going to ask her some questions, and if there's any specific questions you have, please go ahead and just leave it in the comment below, and we'll go from there. So let me introduce my beautiful wife, Leslie.
Hi.
All right, so at a high level, what is Medicare Advantage?
Medicare Advantage is Medicare that has been repackaged by a third party. So your United Healthcare, Aetna, those are two big ones. Humana, Blue Cross Blue Shield. There's some local ones. There's some national ones. To make it in a prettier box, packaged up, it expands some of the benefits, supposedly.
What do you mean supposedly?
What I mean by supposedly is, yes, you're going to get some advantages, silver sneakers programs. There's programs where you can get monthly cash to buy medical supplies, aspirin, Tylenol, whatever. But when it comes to healthcare, it's an HMO. So you have to go to the healthcare providers that are within network, which is pretty normal for a lot of us. But also, it's an insurance company that dictates how you get your healthcare.
What's the biggest difference between a Medicare Advantage plan and a Medicare with a supplement plan?
Cost is huge. Medicare Advantage plans are less expensive for patients. They cost less upfront. Medicare with a traditional supplement is going to be a higher monthly cost for you. They're also cover better. They cover better in terms of out-of-pocket costs. So with the Medicare Advantage plan, you're going to have your copays. You're going to have to meet out-of-pocket maximums. You do have deductibles with traditional Medicare and a supplement, but that's one-time much smaller cost than the out-of-pocket maximums that you get with your Medicare Advantage plans.
So why do many seniors feel shocked the first time they actually need major care on a Medicare Advantage plan?
Medicare Advantage plans require pre-authorization for a lot of things. Of course, if you have an emergency or going to the hospital, they're going to care for you. But after that, that's where it really gets scary because you have to get a pre-authorization from your Advantage plan to even get, maybe it's rehab, maybe it's home health. Maybe you have some new medications that the doctors want to prescribe and you have to get pre-approval and they're telling you that this is the thing that's going to help you the best. I've had, my healthcare background is in skilled nursing, so a lot of rehab, and so that's where my perspective comes from. But we see all the time insurance denials for the care that people need. And what we see on our end is you're going to go to rehab and maybe it's something that in a traditional Medicare plan you would have 3 weeks and you're getting 10 days. So less than half the time that you would get with your traditional Medicare plan, which lets the providers decide what is good for the patient in terms of the healthcare and how that is, how those treatments are coming. Medicare Advantage plans, it's the insurer who decides what kind of care you get, what kind of treatments, and they're designed for profit. Medicare is not. It's a government-run entity. Medicare Advantage plans are run by those insurance providers, and they want it at the end of the day, they're in it for a profit.
How often do you see patients delayed or denied care because of network restrictions?
Every day. Every single day. The pre-authorization process, sometimes it's really swift and sometimes it's not. And what we find is that we have to do a lot of appeals. A lot of your insurance plans will only authorize for 2 or 3 days at a time for that inpatient rehab. And so you come into a building and you're expecting, your doctor's telling you, yeah, you're going to be in rehab. You need rehab and it's going to take, maybe it's 3 weeks, maybe it's 6 weeks, depending on what kind of healthcare issue that you're dealing with. But those Advantage plans, they give you 3 days and then an update and then 3 days and then an update. And we have to start discharge planning For grandma's broken hip, the day she walks into the building. Oh, wait a minute, she's not walking into the building because she can't right now. What's happening is we don't have the time that we need as a facility to rehab people. In fact, just last week, where we were getting 10 or 14 days for these Advantage plans, they decided to cut all of those to 7 days. So the timing or the time frame that somebody gets their rehab is just shrinking. So yeah, if you're going to stay healthy until you're 90 and then just fall asleep one day and never wake up, it's a great option for you. But as we age, our health fails us. And if you ever are going to need any major medical types of treatments, that's where these Advantage plans are designed to deny coverage.
What is prior authorization, and why is it such a big problem under Medicare Advantage?
Prior authorization, and it's not just Medicare Advantage where it's a problem. Prior authorization is where your doctor says you need surgery or you need rehab or you need whatever it is. So the doctor or the facility has to then go to the insurance company and say, okay, we're making a case for this person. This person needs rehab. This person needs a medication. Person needs a specific treatment. And we're trying to prove it to an insurance company. The insurance company then gets to decide if they're going to cover it or not. It's up to them. It's not up to the provider.
If they just did a Medicare plan with a supplement, do they need prior authorization?
No, they do have to follow Medicare guidelines. There's rules there. But no, it is the provider that gets to determine the treatment at that point.
So why is there a difference if you do a Medicare Advantage?
The difference is that the providers get to determine how that health care is dispensed to the patient. With the Medicare Advantage, the insurance company, the for-profit insurance company, gets to decide. And that's why denials and appeals and the whole process is so much more challenging for the patient and for the provider. There's a lot more work that goes into trying to get the care that somebody with an Advantage plan needs.
Why can Medicare Advantage plans end up costing more than original Medicare during a bad health year?
Well, during a bad health year, so you're going to be your out-of-pocket maximum, most likely, and up until that point, that's probably okay. But this is what we see in our facility. Somebody has something health-wise that takes them to the hospital. That's usually the precipitating factor. And they spend a few days in the hospital, and the hospitalist or the specialist says, you know what would really be good for you is some rehab. You're not moving well. You need some time to recuperate. So we're going to try to get you to some skilled nursing and get you some inpatient rehab. So then we start the authorization process. They come into our building, and at that point, they get, like I said earlier, 10 to 14 days of coverage. Well, that's not always 99% of the time, that's not enough time for full recuperation. So then that person goes home and they no longer have the assistance that they need. They're not getting the daily therapy. They might have home health coming in, or maybe they have a really supportive family that can help with that. And that's all great, but they don't have that nursing care that's happening. So they might go home and they might do really well. Typically what we see is somebody goes home and they do okay. And then their health starts to decline again. They're not at 100% when they leave us, and then they end up back in the hospital. They bounce back. And it's just kind of a cycle. So they might be good for, I don't know, a month or two, and then they'll come back because they never really fully recovered. And a lot of, you might think, well, maybe their just health is failing in general. Well, their health had never had an opportunity to come back because of the care that they missed out on.
At what age do you apply for Medicare?
So 65 is the age of eligibility for Medicare. There's some things outside of that where you might be able to become eligible sooner, but that's typically the standard age that you sign up for it.
Once you sign up for Medicare Advantage plan, how hard is it to go back to Medicare with Supplement?
So when you're talking open enrollment, if you have decided to try out an Advantage plan, you have a year to try it out and decide if you like it. The supplement that you might have been on before has to honor your plan and premium. There's some rules there, basically, but you can jump back on it the following year if you decide to without any penalty, without having to do any underwriting. If you have done beyond that year, then that supplemental insurance company has the option. You can still go back, but you have to do all that underwriting. So if your health is starting to decline, your premium is going to skyrocket.
So if a Medicare Advantage plan is so problematic, why are they still heavily promoted to seniors?
Medicare is expensive for the government. So the government has allowed these third parties to manage Medicare so that it costs less. So they get an incentive, or the government pays these insurance companies to manage the Medicare, and then these third party insurers can then package those up and sell it to seniors. And they also want to make a profit on the way that healthcare is administered to seniors, so that they're covering less. Interestingly enough, they are also hiring another third party to help manage all the authorizations that happen, whether that be for inpatient skilled nursing or acute rehab or home health or whatever it is that requires a pre-authorization. These Advantage plans have hired a third party. So now not only do you have the government paying the insurance company, you have the insurance company trying to minimize the health coverage that they're dispensing. They're also having to pay these third party companies that are trying to make money off of denials as well.
If you're going to advise your own parents or grandparents, would you recommend a Medicare Advantage plan? Why or why not?
I have recommended my parents to never get onto an Advantage plan because of the back end costs that you may not see initially when you're trying to figure out what makes the most sense for you. You never know what kind of, when you're signing up for your insurance, you might be in good health. If you're not in good health, then that should give you kind of an idea of what kind of coverage you should do for yourself. But if you're in good health and you feel like you don't need it, well, that's not the reason to sign up for an Advantage plan. I tell everyone who asks me to sign up for Medicare, get a supplement. If you absolutely can't afford that, then really take the time to study the different Advantage plans, because they're not all built the same. And it depends on what area you're in the country as to how those look. I know in our area, I would recommend a couple of different ones. And I'm not going to name names because that's not what this is about. But you have, I work in a building and there's about 300 employees there. And I guarantee you all of the ones that are working with families who are trying to figure out why they're not getting the coverage that they need. Anybody that they talk to in terms of their loved ones, the hospitals that I work with, the social workers that I work with, anybody who's doing any billing, they tell everyone that they know and love, anybody who asks them what to sign up for, to get Medicare and a supplement.
What important details are never mentioned in the TV ads with the celebrities and the smiling seniors?
Well, of course, they're not going to talk about some of the problems. They're not going to talk about out-of-pocket maximums and all the copays, and they're not going to talk about how you're limited to the in-network providers. They're not going to talk about how, you get X amount of coverage, but they get to decide if you get it. They don't talk about any of those kinds of things. What they're trying to offer is that this is a low-cost health plan for you, especially somebody on a budget, but you get what you pay for.
What should seniors know about Medicare Advantage and access to skilled nursing facilities or rehab care?
Okay, so I deal with this on the daily. We have a lot of rehab that comes through our building, and we're constantly admitting and discharging people into that rehab and out of the rehab. What you need to know is that getting you in is work, keeping you in is work. And then you might call up customer service and they're going to say, oh, yes, this is how many days you have. The average that they'll tell you is 20 days. You have 20 days for rehab. Well, that's just not true. They're not going to do that. And they're going to discharge you. Basically what they do is they say, okay, We're going to issue notice for discharge, and then you have 48 hours to get out of the facility. That's as long as you have to make sure everything's in place for that. So it is a really fast turnaround, especially somebody who's been struggling with an illness or injury. And on top of that, if you're not ready to go home and you really don't feel safe doing that, your options are to pay privately. And that's a steep cost. The cost for private pay in a facility is at least $400 a day. So it's not cheap. You always have the opportunity to appeal, but what we're finding more and more is you might win your appeal and the insurance company still can come back and say, well, we don't agree, so we're not going to pay. So as a provider, that's really difficult because we're trying really hard to give the best care that we can, but we also have to be reimbursed for that care because we do have to keep the lights on in our building. So where we want to give those patients every opportunity to exhaust all of their options, sometimes we're kind of stuck because we know what's going to happen on the back end, and how do we give care when we know we're not going to get paid for it.
So if their care is denied, what do they do?
If your care gets denied, I always tell people to appeal. You may not win, but it's worth fighting for that coverage. Insurance companies want you to give up. They don't want you to appeal. They want you to give up because they make more money that way. I always recommend the people that I'm working with to appeal those decisions. Whether or not they are going to win their appeal is a different story, but at the very least, you need to be fighting for your right to that health care that you've paid for.
So if you're healthy right now and you're watching this, Medicare Advantage might seem like the right thing to do. But I hope you learned something through this last few minutes talking with Leslie about the disadvantages of Medicare.
I don't want to scare anybody. You just need to really know what your insurance coverage is. You're your own best advocate.
Also, if this video has helped you, please consider sharing this video with somebody else. Hit the like button and subscribe down below. This is Adam from The Basement Economist. Adam out.